How to get pregnant at 40 years, how to get pregnant at 45 years, how to get pregnant at 50 years, 55 years and over. Is it possible? The answer is yes. And nobody has the right to tell you that you can't get pregnant at 40 years or older, because you absolutely can. A couple of days ago, I went for a seminar. And in the middle of the seminar, a lady got up, a pregnant lady got up to speak. And while she was talking, she mentioned that she's 55 years old. And the whole seminar went agog. And I was like, why judge her? Why are people so fast to judge? You don't know her story. She may have waited for years, and suddenly at 55, pregnancy occurs. What do you expect her to do? Abort it? Absolutely impossible. She has the right to have a baby at whatsoever age she pleases, as long as she is okay, she's fine, she's healthy. But I'll explain something. When a woman gets to her mid-30s, that is around 35 and older, fertility starts to decline, because every baby girl is born with about 1 to 2 million eggs intact. These eggs do not increase, rather they keep decreasing in number. And when she gets to puberty, that is when she starts menstruating, she starts releasing her eggs every month through ovulation and through other means, other processes like atresia and the rest. And at age 40, her eggs start reducing rapidly, not just in quantity, but also in quality. When a woman gets pregnant at the age of 35 and above, it is called advanced pregnancy, because at this age, her eggs are prone to chromosomal abnormalities. And these chromosomal abnormalities can cause defects in the baby, like Down syndrome, defects like Down syndrome. But even at that, these eggs do not even make it up to maturity to form a baby. They miscarry these pregnancies most times. And this is one of the major reasons. This is one of the major reasons women 35 and over find it difficult to conceive most times, because of these chromosomal abnormalities, which means that these eggs, not even most times, they don't survive the process of fertilization and other processes the egg has to go through to become a successful pregnancy. So overall, this can lead to lower chances of pregnancy, especially in women in 35 and 40 years and over. But that doesn't mean you can't get pregnant. Of course, you still can, because if you try the first time and nothing happens, or maybe you get pregnant and it results in a miscarriage, you try over and over again, the next eggs that will be released may stand a chance of becoming a pregnancy. They may stand the chance of getting fertilized and successful implantation, which may lead to a baby in the long run. So in this video, I'll be giving about 7 tips of how to get pregnant at 40 years and over. 3 of these tips will be natural ways of getting pregnant at 40 years and over, while 4 will be assisted ways of getting pregnant at 40 years and over. So you have a lot of options. Number 1, do a full fertility workup. You can't just be having sexual intercourse all the time and every time, hoping and praying that it works. You need to do the needful and do it fast, because at this age, time is of utmost essence. Do all the standard fertility tests. Some of the important tests you need to do include the intravaginal ultrasound scan and the AMH, that is the anti-Mullerian hormone test. This test will help you know how many eggs you have left in your ovaries. They will help you know if you still stand a chance of getting pregnant or not. Another test you need to have is the FSH test and the LH test, the follicle stimulating hormone test and the luteinizing hormone test. This test will help you determine if your brain is still communicating with your ovaries, because ovulation starts from the brain. If your brain is no longer communicating with your ovaries, you can know from the result of this test. because it is the communication between your brain and your ovaries that give you a reproductive cycle or your menstrual cycle. So this test gives you clarity on whether they are still communicating and functioning properly. And also it gives you the result of your levels of estradiol, that is your level of estrogen. It tells you if your estradiol levels are okay. Another one is thyroid function test, because low thyroid hormones can alter the release of an egg from the ovaries. This can prevent ovulation, thereby preventing pregnancy. Of course, you also have to do the estrogen and progesterone test, because this test will tell you whether you even ovulate at all. Another one is ultrasound scan, which shows you your reproductive organs. It tells you if they are okay. It checks your uterus, your endometrium, your fallopian tubes, your follicles. Your follicles are the egg sacs containing your egg, the sacs of fluid that contain your eggs. It checks everything, your reproductive organs, and tells you if they are all okay. The next test takes a closer look at your fallopian tubes, and this is called HSG, hysterosalpingogram. This test takes a closer look at your fallopian tubes and tells you whether they are blocked or open. The doctor will also examine you by doing a uterine sound, which is passing a very slim instrument, usually plastic or metal, through the vagina into the cervix, just to be sure that the cervix is open, because the cervix has to be open for sperm cells to be able to pass through. Then if you do all these tests and everything is fine, your uterus is fine, your cervix is fine, your thyroid is fine, your hormones, your fallopian tubes, everything is fine, then you can try naturally for a period of time, especially if you have had children in the past. Because women who are trying to conceive at 40 and over have a higher chance of getting pregnant than women at that age who have never had children before. I'm not saying that women who are 40 and over and have not had children before cannot conceive. They can conceive, but what I'm saying is that women who have had children before have a higher chance at getting pregnant than a woman who hasn't had children in the past. I've seen women get pregnant and have healthy babies at 45 years and older, so it is very possible. Today's topic is how to get pregnant at 40 years and older. My name is Beatrice Okeke. I'm a certified natural family planning expert. I'm also a Catholic marriage counselor, a coach, a mentor, a trainer, and a consultant in the Department of Natural Family Planning, Fertility Awareness, and Reproductive Health for women between the ages of 20 and 55. Do well to subscribe, like, and share this video, and I want to see your thoughts in the comments. Another thing is your husband also needs to go for semen analysis, because if one person is okay and the other person is not, your guess is as good as mine. It takes two people to have a baby. So he has to go for semen analysis. So he also needs to get tested, and quickly too, because like I said earlier, time is of utmost essence. Semen analysis involves the volume, the concentration, motility, and the shape. Motility is how fast the sperm cells can move. If there is any abnormalities in any of these parameters, this can affect the success rate of getting pregnant. So it's not just for the woman to run tests alone. The man also has to run tests, because like I said earlier, it takes two people to have a baby. So the tests are for both the man and the woman. And when everything has been certified okay, they can now try naturally. Trying naturally doesn't mean they will have to try forever. I'm talking about trying for a couple of months here, because time is not on their side. The third tip is to know your fertile period. This is for women who still have their cycles regularly, who still see their periods regularly, who still have their between 21 and 35 days cycle. Tracking your ovulation and knowing your fertile period is important, because it helps you know the right time to have sexual intercourse. It is simple. Remember, your cycle length is counting from the first day your menses begins to the day before another menses begins. This is your cycle length. The conventional way of tracking your ovulation, which is what most fertility apps and doctors do, is counting 14 days before your next period. But in natural family planning, this sounds more like guesswork or prediction, which is one of the reasons fertility apps cannot be relied on. And there's a high probability that guessing or predictions could be wrong. Watch out for another video where I'll take time to show you how to track your ovulation naturally and accurately. Avoid smoking and excess alcohol. They cause a decline in the quantity and quality of your eggs, and they also cause miscarriages. Avoid excess sugars. Sugar causes a reduction in the body's reproductive powers and also causes your air quality to reduce. It causes a reduction in air quality. So this first set of tips are done or are for when you have done all the tests I mentioned earlier on and everything is okay. Everything seems to be fine. The next set of tips I'm going to be giving is when you do those tests and find out that there are some issues, there are some problems, then you carry out this next set of tips. These are treatments, and the first one is ovarian hyperovulation. You'll be given medication that will stimulate the eggs in the ovaries. This will induce ovulation and stimulate the eggs so that they can be ready for fertilization. These medications are always in the form of injections that cause ovarian superovulation. Another treatment you can get is the human chorionic gonadotropin hormone treatment, HCG. This is the hormone that is used to determine if a woman is pregnant. This hormone can be detected in the blood as well as in the urine of a pregnant woman. The fourth one is clomiphene, also known as Clomid. This medication supercharges ovulation. The fourth one, or is it the fifth? I've lost count, is NAPRO technology, natural procreative technology. NAPRO technology is a method of gynecological health treatment that uses natural methods to monitor and improve a woman's reproductive health. So you see, you have lots of options. And is it possible to get pregnant at 40, 45, 50 years and over? Yes, it is absolutely possible. Thank you for watching. Don't forget to like, comment, and share this video. Subscribe and turn on the notification bell, and I'll see you in my next video.